when it comes to treatment options. Can you kind of walk us through all the treatment options that exist for thyroid eye disease?
I think it's really important to talk about this because the treatment landscape has really changed over the past few years. Prior to 2020, there were no FDA approved treatments for thyroid eye disease. And we were basically treating depending on what stage of the disease patients were at. So I'd like to backtrack a little bit and talk about the fact that we know thyroid eye disease typically has two different phases. The first phase is an active phase where there's ongoing inflammation and change. We kind of call it a progressive phase. Typically lasts about a year and a half to 2 years, at which time patients may enter a stable phase where there's not necessarily ongoing inflammation or change, but the signs and symptoms don't necessarily reverse. So the eye bulging may not go back to where it used to be, but it's a bit more static without ongoing inflammation. Previously, we would treat those two phases very differently. During the earlier active phase, we might provide supportive care, make sure the eye's not too dry, provide ocular surface lubrication. In cases of more moderate to severe inflammation, the mainstays of treatments that would help reduce inflammation, like steroids, even radiation, and other therapies. When patients really got to the more static or stable phase, that's when we would consider surgical options to reverse some of the changes from thyroid eye disease, like eye bulging, correction of double vision, or addressing eyelid changes. And that paradigm of treatment has really shifted since the FDA approval of Tepezza, which is the newest treatment option for thyroid eye disease. It's a monoclonal antibody that's administered via infusion. And what that does is it can actually reverse some of the signs and symptoms of eye disease, including eye bulging, double vision. And so it's really been a game changer for patients. It can be used not only in the active phase of the disease, but what we've found out since FDA approval is that it can actually even benefit patients who've been living with the disease for many, many years and previously been told that there was nothing that can be done to treat them other than big surgeries that patients might not always want to go through.
So, how commonly is this being used to actually treat thyroid eye disease?
Well, right now, certainly in our centers, it's been the first line of treatment and for appropriate patients after like significant discussion between our providers and patients to ensure it's the appropriate therapy for them. But we found that our patients are noticing significant improvements, not just in how they look, but how they function, and also from a quality of life standpoint. It's had a huge improvement in patients' quality of life to be able to identify patients early, treat them, reverse some of the signs of the disease. In our practice, patients may still require surgery. They haven't had complete resolution of their eye bulging or if they still have double vision, but often those surgeries become smaller after they've been treated with Tepezza, which is a benefit as well.
So, when we're talking about the infusion, how long does the infusion take? How many sessions is it? What is the patient experience like once you've decided, okay, we're going to try the infusion of Tepezza?
So how we administer Tepezza is by infusion, as we talked about. The initial FDA clinical trials, which were international trials, infused Tepezza for 8 infusions, 3 weeks apart, and that's typically what's done in practice now. The first infusion is actually just half a dose, and that's to ensure tolerability and no side effects. After that, full doses are given. The infusions typically take about an hour, though the first few are given over a longer period, again, just to ensure safety and tolerability. So the in-office experience is typically an hour for an infusion, but we do keep patients for half an hour after each infusion just to make sure that there's no immediate, post-infusion side effects and they're tolerating everything very well. At Thrive Health IV, one of the unique things that we do is we take the opportunity for having patients during that observation period to actually give them complementary IV hydration with vitamins. We do know that that does help with some of the common side effects of the infusion, including muscle cramping and fatigue, and our patients really appreciate they do get that complementary therapy.
Thrive Health is not the company that makes Tepezza, but it is a company that you're a medical director at one of their centers, and it sort of makes the process of a patient getting Tepezza easier. Is that correct?
Absolutely. So what happened after the drug got FDA approved in 2020, we were infusing it out of our private office in Beverly Hills. Luckily, we have an amazing team with great insurance specialists that have been in the field of biologics for many decades. And so we were providing very kind of expert concierge care for our patients, starting from getting insurance approval to expert nurses who were very familiar with the drug and infusing the drug to physicians who were experts in understanding not just thyroid eye disease, but potential side effects, how to monitor patients and advise them. And we wanted to really be able to provide that care all across the country. So what happened is we established Thrive Health IV to be able to give the same quality and standard of care that we provide patients in Beverly Hills across the country. And we partner with local thyroid eye disease experts to help manage those patients so that they're able to get the same level of high quality concierge care.